If you're vaccinated, you're less likely to be hospitalized and less likely to die. That to me is a black and white that's been very consistent all throughout. Now, there is a lot of changes occurred since the beginning of 2020. The virus has changed so that the illness of COVID-19 is much less severe for everyone, frankly.
Right.
Although some people still get terribly ill. The thing that we need to keep our eye on, literally, is this long COVID, which emerged from the very beginning of the pandemic. I mean, even the summer of 2020, we started to see long COVID. But what's really clear now, 2.5 years, going on to 3 years later, is that this is a real serious consequence of getting infected by COVID. And even mild COVID, it becomes Russian roulette whether or not you're going to develop this long-term consequence.
Young people, spikes in diabetes. People my age, you're seeing increase in cardiovascular problems that are not concordant with simply age. Women more likely than men to get it. Nobody talks to us about any of these things. You're saying at a minimum, people have to be encouraged to go see the doctor every year. Why?
Well, most people are not even reporting to their doctor that they have COVID. And doctors who see their patients with COVID are certainly not reporting it to any authority, higher authority. That's one of the things that is really clear, is that we don't actually have an adequate database to track what's actually happening in the country. So imagine a pilot flying a plane at night without any controls. That's a little bit of what we're actually doing right now. It's a bit of a free-for-all. So I think the key, given the fact that some uncertain number or proportion of people who have COVID, even mild COVID, will develop long COVID. It might be 10%, it might be 15%, it might even be higher. The fact of the matter that young people, if there's ever a need to actually go see your doctor for an annual physical, now is the time if you've had COVID. Now, the health disparities are even greater, because how many people in this country aren't even able to get basic health care?
Right.
That actually is going to actually magnify the disparity.
Dr. William Li, we will keep the conversation going. Thank you for the new information and perspective. Appreciate it.
Thank you, Chris.
All right. Hey, thank you for watching. Please go to newsnationnow.com, newsnationnow.com, and you can find NewsNation on your television provider. And don't forget to click the red subscribe button down below. Then you will get more of NewsNation's fact-driven coverage.